Welcome back, everyone, to the Functional Code. We are excited to bring to you guys today a new episode. We are going to be talking about GLPs. We've done this in the past. We had a long-form content put out on GLPs, but today it's a more tightened and more efficient conversation, really just talking about what they are, which ones are out there, which ones maybe you could think about using, and then, of course, I want to talk today about a structured way to use them, maybe ways that your provider is not mentioning while they're prescribing these to you, or if you are about to get them prescribed, please, these are some things that we think you should be thinking about prior to. So as always, I am Dr. Addy.
Love that. Dr. Jace here. So yes, this is, if you guys don't know what GLPs are, they help a lot with weight loss. They can also help with a lot of other metabolic factors as well. So just keeping that in the back of your mind as we're more or less Dr. Addy goes into some of the details from here, but a huge one that most people are familiar with is semaglutide, which is most common GLP-1 I would anticipate.
Yeah, relatively for now. I would say there's some others that are definitely starting to be more prescribed, but this one has always been the foundation, the first maybe real popular one that was starting to get prescribed, also known as Ozempic. And so everyone here's Ozempic being thrown around, that's definitely what it is. Now, it's interesting because a lot of people don't realize how powerful peptide medications are becoming. Semaglutide is a peptide, and the drug companies use the peptide formula to create the drug. And so what people are not understanding is these peptides that can be compounded in a simple compounding pharmacy are harder to get now because the formula is quote unquote owned by the pharmaceutical companies. So you're finding it to be a little bit more difficult to get some of these compounded peptides. But eventually I think there is going to be a agreement that the monopoly of this technology, this peptide, will hopefully be protected and not just given to pharmaceutical companies to use, because eventually there's a lot more peptides that are being created that are really helpful. And I just hope that we don't get in this loop of peptide comes out and it's starting to show great promise, purchased by a drug company, now they own the patent and now it cannot be used without a prescription. And I can understand the thought process of wanting everything to be safe. You want to go through phases of trials, everything like that. But there's a lot higher safety profile with peptides than drugs themselves. And so there is, I don't know, I hope the administration can come up with a way for peptides to still have regulation, maybe without needing to go through 4 phases of trials. I don't know. I don't know what the most appropriate way is, but some of them, safety profile is immensely high. There's very little side effects and has great improvements. It's just a matter of time before you'll see more people starting to use them. But for now, we're just going to be talking about GLPs. So yes, as Dr. Jace said, semaglutide is a GLP-1 agonist. It's a hormone in your gut that really is a meal messenger. What happens is when you are using GLPs, you start to see a few things happen. First thing, you have a better sensitivity of insulin secretion. So what's great about GLPs is, actually, let's take a step back. Patients who are overweight, diabetic, they have chronic insulinemia. They have high amounts of insulin being secreted all the time, and that is not good for the body. And what GLPs do is they do cause insulin to be secreted, but only in the time of when glucose is present. And so that is the sensitivity portion of it. So why we want that is because when we have obviously higher glucose, we want to be able to take that out of the blood, store it, use it properly. And the second thing that it does is helps to suppress appetite. It does this in a couple of ways, GLP being one of them, and then it also delays gastric emptying. When we have more food, when we have the bolus not being moved far through the intestines as often, it promotes a more feeling of fullness. And that's where a lot of people are feeling less cravings, having less food noise, we'll call it. And that's helpful for patients who maybe struggle with that. And that's really the main uses of, or the main mechanisms of action of semaglutide. It does also help decrease glucagon, which when we have higher amounts of glucagon in the body, we are still secreting glucose from the liver. We're producing it, which obviously we don't want. We have the ability to inhibit lipogenesis, or creation of fat, We also have the ability to decrease food noise. We're fuller, longer, we're having less cravings. And then of course the insulin sensitivity portion, where we're able to regulate our blood glucose levels better, less spikes, and eventually weight loss and regulation of metabolism. So it's a phenomenal peptide in my opinion. It's super effective when used appropriately, and making sure that you have a medical provider guiding you along the way is always going to be the best use when using these compounds. But as we have progressed through technology, we're now seeing what are called dual, tri, or even quintuple agonists, where you have just the GLP-1 being acted on, that's semaglutide. Then came tirzepatide, which is now a dual agonist. So it has GLP-1 agonist and GIP hormone. And so as far as the GIP, it mostly acts on pancreas and fat tissue cells, just to enhance insulin usage, and again, it improves insulin sensitivity. What you're seeing though, and this is maybe not spoken about as often, but with tirzepatide, and I don't see this too often with patients, but some have this issue where there's this, it's called this bias towards the receptor, because there are times where it may act on GLP-1 more than GIP, and there's a difference of results with some patients using tirzepatide versus semaglutide, along with other glutides, what we'll get to in a bit. But I do find that in a small occasion, there are non-responders to tirzepatide.
More so than just semaglutide.
Exactly. And you'll find that, and again, it's rare. There's not many non-responders to tirzepatide. In my opinion, it's the gold standard and what I would use with my medical director and who I work with. But we find it to be the gold standard. It's the most effective with the least amount of side effects. And also, you're just going to see much smoother usage over time. But with semaglutide, you do tend to see a higher side effect profile. And it's not that it's not effective, it's just not as effective as tirzepatide.
So why, between those two, like obviously you go tirzepatide, but why is semaglutide more in the mainstream then?
It was the first to be brought to market. One of the first, I should say.
Sure.
And it was one of the first that was really effective.
Okay.
Some of the first generation GLPs did have effectiveness, but not as near as effective as Ozempic. Okay. So liraglutide, dulaglutide, Trulicity, Saxenda, those are going to be your first generation GLPs, which people still use to this day. Those are very similar to the GLPs that you'll hear in Ozempic, Wegovy, Zepbound, and all that. Okay. But you're going to find that most are seeing more change on those kind of medications.
Interesting.
Yeah. And it's interesting because some respond well to your simple first-gen GLPs. Some have been on Trulicity forever and didn't see much change. So instead they switched to glutide or tirzepatide, and they found finally some actual, what they were feeling is change, maybe more weight loss or feeling better, regulating their blood sugar. And a lot of these patients too are diabetic. They're type 2 diabetic. So a lot of it is going to come with other metrics that they're measuring, blood sugar regulation, weight, those kind of things. But most people who haven't heard of this before, they have only ever contributed, or I guess compared it to using it for weight loss only. Okay. And it never actually had a label to use it for weight loss until recently. You were only able to use it on label for diabetics only, type 2. Okay. I'm still waiting for them to come out with a type 1 diabetic one. So that is technically still off label. You're not supposed to use it. However, I have heard plenty of people using it with type 1 and it's helping. Awesome. Yep. Okay. It's just hasn't been studied or gone through trials.
That baffles me.
Yeah.
It's interesting why they wouldn't try, if it's for diabetics, like just even that type 1, type 2 doesn't matter as much.
No.
Interesting.
And for those who are using GLPs, they're already noticing this. I'm sure, I have looked into it. You'll read this as well, but there is a dose response to a lot of patients, and that schedule needs to change over time to continue to see results. Gotcha. I'll see this a lot. Patients will start out with a certain milligram dosage. Eventually they plateau. They'll need to start taking more and more of it in order for the receptors to, there's some saturation to it. There's definitely some saturation to it. So that's where the concept of microdosing comes in, where you're using less of it, but more frequently, because there's this theory that it can obviously improve over time benefits of it, but maybe not as saturating your receptors as much. And then there are those who are recommending 5 to 10 times the beginning dosages just once a week, and they're just pounding the receptors. You're seeing change, but over time it does plateau, and you can't really go up from there. And so you have some of the modern, we'll call it, I don't want to call them biohackers, because I definitely feel you should be working with a medical doctor. Some of these people who truly understand the body, they know how to use this product. They're very smart when it comes to using the least amount as possible, and then maybe more frequently, and then just listening to your body and using it as a tool, not just taking the medication once a week and then doing whatever you want without any actual thought towards it. It's okay, I get to take it now, I get to do what I want, I get to eat what I want, and I'm going to lose the weight anyway. And some people are lucky enough to have that happen. But over time, if they're not resistance training, if they're not consuming enough protein, and of course if they're not thinking about getting off of it at one point, it's just going to become a dependent medication, and it's not going to actually improve your lifestyle or your health over time. Yeah, you might lose weight, your comorbidities might improve, all these other things. It's great. It's a great product. I'm not denying that, but some of the research out there is showing 6 to 10% of their muscle mass or body weight percentage in muscle mass loss over this research.
6 to 10, that's a lot.
That's a lot, and that is a very important organ to maintain over time.
Yes.
So that's where I start to get a little concerned, because these older people, let's say 55 up, they don't have the ability to pack on 6 to 10% of muscle mass even over the next course of their life.
100%.
They'll be lucky to put 1 to 2% on a year.
Trying to maintain.
That's a huge drastic loss for them. That's just not something that's being communicated, I think, to patients, in my opinion, and it's definitely not from what I hear when I talk about it with patients. I had a patient the other day tell me that they've been on Trulicity for 2 years. To me, that's not how this should be used. It should be a tool to help you lose the weight, and then during that time, as you're feeling better, you're able to move more. You need to start working out, start being able to maybe do the things that you haven't been able to because the weight has been very taxing to your body. Start learning how to eat properly and how to maintain that without the need of a GLP, and then get off the GLP. Because I think over time, there's no reason that you should be on it for long term. I don't want to start seeing muscle mass loss. I also don't want to see a lot of the other symptoms that it's out there. There's lawsuits now against these pharmaceutical companies because of whatever that's on the lawsuit. But again, these things were stated. These drug companies knew that this was going to happen. This one wasn't as much of a rug pull as I think people are thinking. We all knew, I as a provider, and I knew all. This was put it in their research. They didn't hide this. Yeah. Some of these things we knew right away starting out, and we've known for a long time because these have been studied for a while. Stomach issues, pancreas issues, liver. This is all out there. This wasn't a surprise. In my opinion, the patients that were having these issues were ones that weren't being managed appropriately. They've maybe been on it for too long. Maybe they're at a dose that was way too high, and they were losing the weight too quickly, and they were just getting these issues. Maybe they weren't qualified to use it. Maybe they already had underlying organ issues prior to, and they just weren't vetted. And I doubt the provider even talked about doing diet and exercise changes first before trying it. All these other things, right? Do I think it's something you should be scared of to use? No. But there are risks with using it, and you should make sure that your doctor absolutely qualifies you to use it first. And there are some things that they should ask you.
And if you guys want more information in terms of how to start that process of the diet, the exercise, eating right, habit formation, we did a podcast with Bo Chris, the Ozempic trainer.
Yes.
Definitely check that out. This episode is going more in depth on some of the in-depth aspect of GLPs, where that episode's more on the training with using the GLPs. So by all means use that. But I think that goes into the next point of, one of the next points of, if you don't build these habits, if you don't have this exercise workout involved into your whole regimen, that they stop taking these GLPs and then the weight comes back.
For sure.
And then they're twiddling their thumbs of, I just spent all this money, and then where do I go from here?
And that's a great point. We don't want all of this effort to be wasted. Yeah. These are awesome results that people are getting. And we want you to hold on to them. We want you to have them. And the only way to really maintain, and I love Bo's statement on this. He goes, GLPs are a tool, but training is a lifestyle. And that is what it's going to prepare you for. And so we only want you to have that under your belt and ready to start using it day to day. We don't need GLPs day to day. That's not something that we're preaching. So yeah, that was a great point by Bo. And again, recommend that podcast. It was super helpful for those who are definitely using GLPs. But now we're getting into more of the, I wouldn't call it experimental because this will definitely be a drug one day, but it is still considered experimental because it's going through trials. But it's a triple agonist.
Dang. Okay.
It's called Retatrutide. Reta is the short name for it. So a lot of the people that are using it right now, that's what it's short named for. So we'll call it Reta from here on out. So Reta is a triagonist. It works again on GLP, GIP, and then now it's a glucagon agonist. And what they're seeing, surprisingly, and I'm still trying to wrap my head around everything that this is doing, but the thing that it is improving is still weight loss. You're still seeing a lot less side effects, which is great. The side effect profile is similar to maybe Tirzepatide. But what you're also seeing is protection of lean mass and your ability to see less muscle mass come off once you're using this product. It's a great, I think it's the final piece that was missing in terms of GLPs. Also, a lot of people that are using it it's almost acting like a thermogenic in a way. They're sweating more frequently, and they actually have this like rampant uptake in metabolism. And that's definitely something that you didn't quite see with the first two gens. A lot of people who take Reta, they're experiencing symptoms that were not necessarily experienced on the first two GLPs that we talked about. There was a gentleman I was talking to who used Reta. He said he couldn't stop eating. Wow. He said that he was shredding so much weight, he was sweating, and he couldn't stop eating. And even though he still ate as much as he did, he was still losing the weight. And so I am still working with clients on this. This one I haven't been using as often or as much other than with Tirzepatide and Ozempic, but I'm still learning more, and I think we're still going to gather a lot of information on this. But most of the bodybuilders that I've talked to are using this.
Interesting.
And it's very commonly used in that space. And so you will definitely see this popular once it becomes a medication or a drug. This, I think, will take the hierarchy of order of prescriptions once this starts to be prescribed.
Question for you, Doc. With that being said, would it be more advantageous to go this route versus semaglutide? Let's say if someone doesn't want or ever has the ambition to ever exercise or improve their diet.
So you're saying, make sure I understand your question, for a patient who has really no interest in improving their lifestyle, they only want the product, would Reta or semaglutide be a better option? I would say it's going to depend, and I wish I had an answer because it's tough. Most patients want results. And from what I'm seeing, Reta is going to get you that. Now, you cannot get Reta from a doctor. They can't prescribe you. It's not a drug yet.
Gotcha.
You can only get this from a compounding pharmacy. Now, a doctor can get you it from a compounding pharmacy, but not many doctors like to do that. You're going to find that maybe more from a naturopath physician or nurse practitioner who's maybe more functionally or holistic wellness minded. My medical provider, obviously him and I, we think similarly, and we're wellness functional based, so that's obviously what we're thinking about. But you definitely very rarely will walk into a hospital, ask for this, and I doubt many will give that to you. So
interesting.
But as far as semaglutide or Tirzepatide, absolutely, they would make sure, I would hope, qualify you, and then that prescription is very easy to pick up. So as far as ease and access of getting it, semaglutide would be the answer.
Okay.
Also, semaglutide and Tirzepatide, far more data on usage. So if safety is a concern of yours, that's usually where I first have that conversation with my patients, is the options of what to use, and then if they want it to be something that has been tested and they want that safety and concern, then absolutely, we will start with Tirzepatide. I've done some semaglutide, but I really do like Tirzepatide. That's what I use mostly with my clients. But now Reta is starting to be exciting, and I think I'm excited to use it more and see how it works with certain patients.
Love that.
Yeah.
So I know this goes back to a conversation we had previous, but Tide wasn't always the first first GLP that came out.
No.
First
there was
generation
So liraglutide, dulaglutide. I think there was one that started with an E that they exotitide that they actually first started the research on from salamanders. I think it was.
Interesting.
Yeah, I think that's how they, if I'm not mistaken. Don't quote me on that, but I'm pretty sure that's what it was. It was some reptile.
Sure.
And that's when the research started. So yeah, there has, and that was a while ago. I want to say in the 90s, if I'm not mistaken.
Okay.
And that has been built off of since then. Wow. And so these have been around, and they're, in my opinion, a very effective, safe, when qualified way of lowering weight, improving blood sugar.
Well stated.
But I think a lot of doctors are still missing the mark because there's no management. The prescription is being prescribed, but then there's no management. There's no goals that are set. There's no education being done. You're not teaching them or educating them on how to do other things outside of just taking the medication. There's no integration with personal trainers or therapists. There's no referral to your PT or trainer for resistance training, upkeep while you're using the GLP. Maybe there's a referral to the nutritionist now. I don't know if that's something that's incorporated in all hospitals. I doubt it because I haven't heard it from my patients. All of them that were prescribed it, I always ask, I say, hey, what did your doctor tell you when you prescribed it? They said, I've heard this too. Oh, he gave me the script and said I can eat what I want. I'm not lying. Like, they tell me this.
Oh, Lord.
And I get that it's an easy conversation to have. It's so easy. I just want to help my person, my patient. This is going to make their life easy. It's going to help them lose weight. And I know the research, once the weight is down, is going to help their other comorbidities and things like that. I totally get that. This is a super great advancement in healthcare technology, but you're being negligent because they continue to take that for as long as they do. They will end up hurting themselves.
Long-term effect.
That's what I'm worried about. I'm worried about the long-term effects, which we still don't have a lot of research on. But these patients ending up in the hospital with gastroparesis and with pancreatitis and some of the other more common stomach issues and other things that are happening. Dehydration, it can increase the chance of that. You're seeing kidney issues happening if they've already had underlying kidney issues. These are all things that needs to be spoken about and managed.
Yes.
You can't just prescribe, walk away. I know it's easy to do, and doctors are busy, and I'm going to give them the benefit of the doubt on that. But I do think there needs to be just a little bit more concern and education right away once you prescribe this. And that's going to be adequate protein intake, resistance training, and a date to get off of it. That's it.
Yeah, and even with some of this, like more emphasis, like maybe they have a handle they give a patient, but whoever actually looks at that to a certain extent,
Right.
I think it's more of a concern long-term for the muscle mass, for the habit formation. Like, life's a journey. Does that make sense?
And that's where you don't see that a lot. There's not a lot of foresight in primary care. They really are just there to help you when they see you. And yes, there is some long-term management. They obviously want to keep your blood pressure down, and they want to keep your cholesterol down. And yes, that's the main ones. But there is still a lot of areas of improvement when it comes to education, in my opinion, in that area. And it's not that difficult as long as we integrate with each other. The healthcare model of the future, where once we prescribe that, we have a nutritionist on hand to talk about that day. And then now they're starting next week with our trainer in-house who starts to train them simple stuff. And that is the management. Now they're coming back to you. You get to talk to them every week. It doesn't have to be for the provider who's busy. I get it. You just have to 15, 20 seconds. How you doing it? How you feeling? Any side effects changes? What can I do? And then let my other team, part of the team, manage you. That's still most appropriate. I think we're only, I hope within a few years, we start to see more and more of that. If not, I'm going to build it. I don't give a shit.
Let's go. So people are still using these first generation GLPs,
Yep,
correct?
very common. Still very common. the ones that I can remember off the top of my head. Trulicity is one, Saxenda. There's one that starts with an L. I can't remember that one, but yeah.
With that, so with GLPs, can you take them orally, or is it all just injection? They get into any other nutrients?
They are starting to create an oral GLP. It starts with an R. I think it's like Rybelsus, but you can. And from what I'm seeing, it has similar changes. They are even starting to create other oral GLP-1 activators. One that comes to mind is oligoprofilone. Oh my gosh, I got to look this one up again. Or forgliprone. There we go. It's not a peptide. It is technically a small molecule. I think it's too big to be a peptide. It could be classified.
Oh, gotcha. Okay.
But still a small molecule, and it does act on the GLP-1 molecule. And they're seeing, so it's oral, which is great for patients who don't want to do the injections if they just have a huge phobia of needles. It is daily instead of weekly. Most GLPs are weekly. And it does, from what I think, there's a phase 2 trial that has been started, or actually, no, let me back and make sure I have that right. I'm pretty sure, no, ongoing phase 3 trial, yes, for not only a diabetes, but obesity. And it's showing similar efficacy to injected semaglutide.
Oh, wow.
Yeah.
That's beautiful.
Again, I think it's a great route for patients who don't want to do the injections, so it's nice to have. I think also the once oral a day is maybe helpful for just that for the body, where you take it, there maybe is some food noise regulation per every day.
Like small microdosing?
Yeah, in a way, just frequent dosing.
Gotcha. Okay.
You're still probably taking the recommended dosage that they're doing in the trials, but again, this is in trials only, so the only way you're going to be getting this is purchasing it from a compounding pharmacy, and that's, again, making sure you're using a provider with this. I have never used it, but I've read about it, and I know a lot of people who have used it. And again, it's a great substitute for those who don't want to do the injections.
That's beautiful.
Yep.
It makes a lot of sense. People that are needle phobia.
For sure.
Have needle phobia.
For sure. And I think, again, most people are just used to that way of intaking it orally. And so if that's just what they want, at least that's the option for them.
That's beautiful.
And again, these kind of things, again, peptide or small molecules, non-drugs, less side effects, more safety profile. And again, if you're seeing change, that's what we're looking for. We're looking for efficiency, but also making sure we're not harming patients.
Yes.
Yep.
So with this next one, the quintuple agonist.
Yes.
How the heck did we even get here?
I don't know, man. I'll tell you what. I definitely looked. If I saw this coming, with how we're advancing as a culture, which is bigger and better. And when you saw the single agonist semaglutide, dual agonist Tirzepatide, now we're at triagonist with Reta. And they're already talking about a 5 and a 7 agonist.
Wow.
Personally, I have a tough time understanding what the results are going to be like. The 7 agonist only has trials done in animals. So we're not even close to.
It's so much physiology.
Yeah, we're not even close to seeing this in humans. I hope,
imagine, yeah.
because we still have to figure out long-term usage of our current GLPs. But I do think the more agonist approach is just going to obviously improve the outcome of what they're trying to achieve, which is probably regulation of diabetes and weight loss, yes, which we need. I agree. However, I just have a hard time believing that it's not going to only cause more issues. The more things that we try to change biologically, maybe I'm wrong. I still am trying to read more on the research being done on the 5. There's not much on it.
Okay.
Again, because there's nothing done in humans yet, so it's just all animal trials, and there's only so much that you can take physiology-wise from that.
And even outside GLPs, you can see the trends over history with medications, the other side effects, and that's where I feel like a question mark comes in, big one.
Yeah, again, I'd be curious to see if this does even get into humans, what the effects will be, and if it's going to make it safer and more effective, or it's going to make it just more effective but not as safe. I'm still trying to understand and wrap my brain around that. But what I would hope our researchers can work on or do is, how do we hack the physiology of resistance? How do we hack the attempted effort, but failures of people trying to change their life. Like, is there wearables that we can start wearing that make us feel better so that we can work out longer? I don't know. Is there ways that we can start hacking our psychology to eat better, to move more frequently, to, I don't know. Is there ways that we can start actually focusing on improving and having people retain that kind of lifestyle and not just obviously only focusing on drugs, which again, there's always going to be that in the background. But I just hope that there can be an advancement in that area where we can really push and make that easier somehow. I don't know what that looks like. I obviously would have built it if I knew.
Yeah.
But I do think patients who only are focused on eating better, moving more, resistance training, they aren't going to need medications in the long run, as long as they stay consistent. And I think most of you know that's not the argument.
You just don't want to hear
it. You just don't want to hear it. You want something quick. And for those of you who are trying it, and I know it's hard, it's tough to keep up on. Like, we get that. So what could we have in place that's safe and effective to help maintain weight training over time? I know they're doing a whole bunch of AI technology to help keep track of everything on a screen for you, where you don't have to memorize reps and you just have it all done on a program and all those other things that I think are helpful. But other than, I don't know, could you press a button where your bed takes you to your car and your car takes you to the gym, and then finally you're at the gym and you didn't even have to lift a finger? Maybe. Gosh, that would be nice. But guess what? You still got to move your butt in the gym, so I don't know. There's no machine you can hook yourself to that just works you out. Maybe they're going to build it. I don't know. But
Incredible.
I do feel that's still going to be the area that you should be focused more on, primarily. Eating, moving, and stress.
That comes almost with like psychologists mixing in with exercise physiologists.
Yes.
And then they have a background with whether it's GLPs or, because there almost has to be a specific foundation that you have to have, either a provider or a researcher or what have you, to make sure that these habits are built in. And I don't feel like I'm sure researchers have a mixture thereof. I feel like they know it, but we probably need way more of those individuals.
Yes.
And louder speaking to the community, more or less.
And I hope we get there. I do. We do our damnedest, and we appreciate everybody who does listen to us. I know it can probably sound like a broken record sometime, us talking about this, but it's only because we truly know what the difference it'll bring to your life when you are doing these kinds of things. We practice this stuff every day. By no means was it easy for us in the beginning. I'm sure Jace and I can both remember our first day in the gym and how uncomfortable it was around much larger individuals, seniors. We were probably freshmen or seventh graders. And yeah, it can be a fear to compare yourself right away and feeling like you aren't knowing what you're doing right away, and you don't want to look like a fool starting out because you don't know anything yet. And that's where I think hiring a trainer, if you don't know anything, is a great step just to get started. You don't have to train every day with the trainer. Maybe once a week, have them teach you some things, and then you go do that on your own. There's ways that they can work around with you.
And everyone always has this statement that they always can say, doesn't matter who you are, fitness is a journey, not a destination.
Yes.
And that is where all this comes from. So whether it's someone that comes to talk to you in the gym, someone's under me and you, they're in their own journey, you're in your own journey, that can relieve a lot of stress. And every time I've said that statement to someone, it's helped them break through a barrier to even just get them into the gym itself.
Yeah.
So whatever you have to do, just put the work in to a certain extent. Put the work in, and then obviously stay with it.
Yeah, and that's the key. If you can do this long term, the effort you think you're going to put in the first 3 months is nowhere near the outcome you're going to achieve just being able to stay consistent over years to come. So, guys, you don't have to achieve what you're trying to achieve in 3 months, and you probably won't.
Yeah.
So stop thinking that you're going to. Stop thinking that you're going to hack your way around hundreds of years of physiology when we all know what the destination is for you at the end of those 3 months. Yes, you've lost some weight, you look toned, you feel better. Perfect. But trust me, when I say this, if you quit doing that, you aren't going to feel the things that you've been continuing to feel.
Even if life happens,
Yeah.
like you have family, kids, there's a lot of stuff like just getting back into it slowly and staying with it slowly. It's a lot, but it will help.
It will, yes. I included all the references that I spoke of on today. Each of the references will have the length of the trial, what the dosage was, and then the outcomes. And I think it's helpful for those who just want to read more about that. Again,
it's a table.
Yeah, I'll just say maybe in the links or something.
For sure.
Yeah. But yeah, if those of you who are interested, you can read more on that. But yeah, again, tool, not a shortcut. Get off of it, stay in the gym, keep eating well, stress, all the fun things we talk about. And yeah, thank you guys so much for listening. Hope this was valuable. Please share with someone that you either know or feel could use this information, because we hope it gets out there. So again, thank you guys so much. Until next time, guys, have yourself a great day.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate, and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.